All right. So, yeah. So I think some people mentioned to me that they had issues just navigating through the program, but it's not that difficult. Let me just, when you come in, on the left-hand side, you have all the questions, okay? And let's say for this, tell me about yourself. The sample answer is first, all right? And then you have a framework video. Then you have templates for, let's say for internal medicine. So you got templates that you can use and plug in your own details. We got family medicine, pediatrics, neurology, psych, general surgery. So most of the questions have multiple templates. Many ethical questions may not have it because the ethics goes for everyone. Anyway, so stop sharing, and I'm going to give you, as we normally do, I'm going to give you a couple of answers. All right, and then we'll probably open things up, and we will definitely look to mention and touch on the questions that Noor also had. So yeah, so let's start pretty quickly. Let me see which question I'm going to touch today. We're going to do some ethical and situational questions, and hopefully we have a better understanding. All right. Okay, let's see which one did I list out. All right, great. All right. Anybody else had any other questions coming up for them that were perplexing, perhaps? Nothing much.
Hi, Dr. Umar.
Hello.
I had an interview yesterday where they asked me that what would you do if a patient dismisses you or like refuse to give you any history? And then I have an interview upcoming soon where it's for family medicine, and they have like an whole hour just for the behavior health question.
Oh, okay. Okay, let me write this down. What if a patient dismisses you? Okay. All right. So this is a question on how do you handle a difficult patient? Okay. So I'm going to add that below as well. And actually in the program, there's a video handling difficult patients. So that may help out as well, but we'll go over these. Okay. All right. So let's start. I think we are enough people over here. All right. So dealing with, I think the first question that people come up with is, and I've had somebody mention that two people actually mentioned that this question came up, dealing with constructive criticism. Now, we have been trained, or we think at least we know everything, right? And we practice, we study hard, and we think we're the best or we're the cream of the crop for the whatever country we're from, right? But we're always learning. And because we have big egos, so we end up at times, let me do the presenter view. Okay. Speaker view. All right. So at times we feel that we are the best there is, the best there was, the best there ever will be, right? And we can't make any mistakes, right? But that's not the case. We're constantly learning. And it may seem a little awkward if somebody is giving us criticism. So normally the question is about constructive criticism, but however, most of the time, in real life, you don't have real constructive criticism. The person may criticize you in a backhanded manner, right? But let's talk about constructive criticism, and we'll end with how you will deal with a backhanded criticism where somebody has not been that nice when they give you some feedback, right? Okay, so hey, doc, what will you do if you made a mistake, any type of mistake, and your attending comes and talks to you, or your senior resident comes along and talks to you and give you some feedback? Um, how would you actually go around handling this? And have you done this in the past? How have you dealt with constructive criticism in the past? Okay, now the candidate. Well, good question. And I do see that I've learned actually that constructive criticism is actually a valuable opportunity for my own growth. And I have learned that I need to actively seek criticism to improve my own skills. And I do remember during one of my internal medicine rotations, I did receive feedback from my attending that my patient presentation skills needed to have a bit more structure to it. Initially, since I was just new to the ward, I was a little bit taken aback, but I quickly realized that this is valuable and feedback is valuable to me. I asked for specific examples and a bit of tips from my attending on how I could improve. And I implemented these suggestions. And in my next presentation, I was much more confident and I was able to handle more complex cases in a much more organized manner. So I do welcome constructive criticism, and this is what has helped me. And I do feel that in a stressful environment, as in on a medical floor or a surgical floor or a psych ward or a busy family practice clinic, uh, I do feel that you may not always get constructive criticism, and a senior or even a colleague may not be that kind or be thoughtful enough to give real constructive criticism, and they may end up being a little rude. But in a medical setting, you have to realize that, hey, it's all about patient care. It's all about being a better physician. And even if somebody has been not the best in their approach, I feel that I would think for 2 seconds that, hey, okay, is this advice or is this feedback that this person is providing me, is that actually useful, or it is just malignant? If it is, definitely useful, I would, suck it up and I would realize that, okay, yeah, thanks, thank you. I realized that was a mistake I could work on. So whether it's constructive criticism or much more straightforward criticism that is probably more to the point, I think I've learned to, take it nicely and look to improve myself, because, I'm at the stage that I need all the feedback that I can get. Thank you. All right. How was that? Reasonable? Maybe? Yes, no, maybe so?
Yes, I think that was great.
Okay, all right. So that was, I think, an example of internal medicine, but you can do anything. Let me give an example for family medicine, perhaps, right? So that you can give an example that, hey, this happened to me, this happened to myself when I was in such a situation, and that's how I dealt with it. So most of your questions, if you answer with an example, that's usually a better deal, because they will say, okay, yeah, they're just not speaking it. They probably went through it, and they will realize that this situation is definitely valid. So let's give an example of a family medicine, since a lot of people have family medicine interviews. Okay, so okay. So I do see that constructive criticism definitely has a lot of value, and it is a valuable tool for my own growth. And I've I have learned this from my experience. And especially in family medicine, I do believe that, criticism is important and patient communication is key. And once when I was in my outpatient family medicine clinic rotation, my attending did provide me some feedback that I needed to improve my preventative care counseling skills better, particularly when I am discussing lifestyle changes with my patients. And I realized that, yes, my approach was a little too technical, and I was not meeting the patient where the patient was, mentally at least. So I asked for specific suggestions on how to communicate more effectively, and he gave me an example. And by implementing some of these changes, I realized that I have to be a bit more simpler in my language and more motivational in my interactions with my patients. And I did see a significant improvement from my very next patient, and I have worked on that. And this is how I deal with criticism. I look to see, yeah, that seems as a valid piece of feedback, and yeah, and I take it in, and I improve upon myself. And I am at that stage that I have to take feedback. I'm just learning. I'm at a very beginner stage right now, but yes, that's what I've learned so far. Thank you so much. Okay, so scenarios, internal medicine, you can do different scenarios. Psych will have their own scenarios. So hope this should be the approach. Even if you memorize answers, try to be a bit more casual. Try to not sound robotic. Make it seem casual. All right. Okay. Anybody wants to take a jab at it? Anyone wants to give it a try to answer this question? The more you practice, the more you learn, actually. Anyone wants to give it a try? Anyone? Or should I pick someone? It's very easy. It's better to make a mistake right now than in the interview. Okay. It's better to make a mistake. Okay, Amrit, you want to go ahead?
Yes, sir.
Okay,
Yes,
where
sir,
are you
sure.
applying to?
I'm applying to currently pediatrics, sir.
Okay, pediatrics. Okay, all right. Yeah, I have template answers for pediatrics as well. But anyways, so okay, so Doctor, what's your last name? Kanil?
Kanal.
Kanal.
Yes, sir.
Dr.
Yes, sir.
Kanal, how are you doing today?
I'm doing very good, sir.
All
What
right,
about
excellent,
you?
excellent, excellent, excellent. All right, well, I know you're in a good mood, but you know, when you're on the pediatrics floor, you know, you're dealing with your patient, with the little child, you're dealing with the family, you're dealing with the attending, your senior resident. You know, somebody's probably not going to like what you're doing, and they're going to give you some little bit of feedback. And you know, you're stressed out yourself, right? You have so many things happening. Nurses are calling you, you're getting calls from the ER, but somebody says, hey, you could be a little nicer to the parents. How would you deal with that criticism?
Actually, while I was working as a emergency medicine physician in the emergency floor, I had one instance where uh, a patient party the situation was very rushed because a child with organophosphate poisoning was brought into the emergency department, and we had to act very quickly, and we have to make quick decisions at a very with very limited resources at that time. And it was being very difficult to counsel the parents as well as other patient family members. So at that time my attending arrived, and he gave me a feedback about the patient counseling, which at the time I felt was a bit more overtly critical. And because I have given my best, and instead of criticizing at the moment, he should have given me a positive feedback. At the moment I felt a bit low, but I then realized that it was actually a growth opportunity for me. Then I approached to the attending, then I asked how can I improve myself in the further similar situations, and he provided me with the feedback on the different counseling techniques. Then later on with that similar condition, I was very good at counseling, and I especially uh, kept my focus on counseling the parents effectively, and he actually uh, praised me for that as well. So from that moment onwards, I have learned the importance of empathetic and compassionate care to the family, and we are just not only treating the child but also as family as a whole in that approach. And I have carried on that approach forward with me, and hopefully I will be more better in the upcoming days. Thank you very much.
Okay, great, great, excellent, excellent. Good job, good job. Oh, somebody has some messages. Let me see. Okay, great, great. Okay, so all right, we'll move on to the next question. Okay, so we cover as many questions as possible. All right, so what other question we had? All right, so this one has come up more than a few times that people have told me, that is under the influence of alcohol. If you're attending or your colleague or anybody else is under the influence of alcohol, that seems to be coming up. Just not alcohol, it could be any drug for that matter, right? So it happens in a residency that you had a party last night. It could be even a residency party, right? And somebody just stuck around more and had a few more drinks than somebody else, and then they came into round at 7 in the morning, and you know they're looking a bit different from what they're normally looking, right? So um, the fact of the matter is that professionalism, responsibility, and upholding the ethical pillars of the profession is what is most important. And with all of these ethical questions, that's the answer. If you say professionalism, responsibility, and upholding the ethics of the medical profession, I think you will be right most of the times. Okay. So, but how to answer it, right? So, all right. So doctor, what are you gonna do if you are rounding in the morning and your attending doesn't really look right? How are you going to deal with that situation? Okay. What are you gonna do with it? All right. Well, that's a very good question, and I know something like that could happen. If I did notice that my attending appeared to be under the influence of alcohol or any other drug for that matter, I think it will be a strong ethical responsibility for myself and my team and the team that we're working together, that we act swiftly. And I think I will look to initially discreetly confirm my concerns and suspicions by monitoring his or her behavior. And if I see that he is slurring his words or she is forgetting common things or forgetting what happened to the patient yesterday, perhaps, I will not approach the attending directly. I would step aside when I can and talk to any supervisor or a senior resident, or any supervisor in the program, just to say, hey, I did notice a few aspects of this individual currently during morning rounds. I just want to relay this, and if you would be kind enough to explore this further, if you feel that this is pertinent, and I will let them deal with it. And I would say things as a matter of fact. I will not exaggerate anything. I would keep this low. I will not share this information with anybody else. I would do this very, very discreetly and not to create any type of a scene. And I will let the department take it from there on in. And yeah, I think that's how we'll look to approach it. Okay. So some people in the past suggested that you will talk to your attending first. I personally am not of that view. I would suggest that we go to some higher up and inform them and let them deal with the situation, let them do their own investigation. Okay. So I think that's how we should do it. Anybody want to take a jab at this answer? Anybody want to give it a try?
Why is it not
Beanish, are you talking or? No, okay, maybe her just mic is on. All right, that's okay. That's okay. But yeah, you guys get the gist of it, right? All right. Okay, so then and Noor had the question that she was asked, that she had a recommendation, but they did not like her recommendation, right? So this is a very common question. How do you handle conflicts in a medical setting? How do you handle conflicts in your medical workplace, with your colleagues, perhaps, right? So this is a very common question, and they can ask in numerous ways. But if you just understand, the principles again are going to be professionalism, responsibility, and ethical behavior, and upholding the ethical standards of the profession. You take these three in all of your situational questions and ethical questions, then you are fine. Okay, you just have to make sure your answer is ethical, your answer is professional, and then you will be perfectly all right. And responsibility is the main pillar of this as well. So ethical, responsible, and professional with any of this. All right. So how do you handle conflicts? Noor, do you want to give an answer first, just to see how was your approach? What do you think? I don't want to put you on the spot, but it's up to you. I'm not sure if she's still here. No, I think she's on mute, so it's okay. Let me just go over this answer. All right, so, all right, good question. And I do believe that in a high pressure, high stress environment such as medicine, conflicts can definitely happen, particularly when there is some misunderstanding. And I do realize the most issues happen due to communication issues. And my approach has always been that I believe that resolving conflict is through open communication and collaboration. And there was a busy shift that I remember during my final year of medical school. And we were actually in the ER, and the patients were not being distributed appropriately, at least to myself. And I got fairly upset because I felt that my fellow final year medical student, was not taking as many patients as they were giving me. And I personally got a little upset because I was overloaded with my own patients. But I thought about it. I said, let me try to figure this out and let me try to communicate it in an open manner. And I mentioned that, okay, I see that you only have 5 patients and I got around 8 patients already. My resident was nice enough to talk to me that, hey, I see you have a few more patients, but I have a few more sicker patients. And I realized at that point that I definitely need to step back a little. And that person, that colleague of mine is actually under more stress or equal stress based on the acuity of the patient that we are handling. So rather than I let the situation escalate or I complain in a improper manner, I took the moment to pause and asked how we can quickly resolve or understand this issue better. I looked to explain my situation and I waited for the other person to communicate back to me. And because of this, my own apprehensions were resolved. So whenever there is a conflict, whether it's my fault or somebody else's fault, I look to prioritize communication and being proactive in addressing the issue. And then we were able to focus better on patient care. So yeah, my main goal is to communicate properly. And that's how I would look to approach any type of disagreement or conflict among colleagues. Thanks for asking this question. Okay. Maybe a sample answer, what do you think? Possible? Okay. Yeah, dude, that's okay. That's just send me a message. Okay, that's fine. That's fine. All right. All right. So anybody wants to take a jab at this? How to handle conflicts in the workplace? Anybody wants to give it a try? It's better to make mistakes here than, in the interview. Right? Anyone?
Okay, I'll go.
Okay, Bilal. All right, great. So, Dr. Bilal, you are here in the morning, right? And what else? What's the scenario? You are here in the morning, and you got a list of patients from your senior resident, and there are some overlapping patients that they messed up on. They messed up your census. They messed up the lists. You got some patients, and the other intern got a few patients, and you are overlapping. And both of you want to take the easier patient, right? Both of you want to take the easier patients when you realize that, oh, there's an overlap, there's a mistake. How do you go about handling this conflict in the workplace?
Yes, that's an interesting question. I believe that conflicts are like a part of life, especially working in a busy environment like a clinical setting. And most of the conflicts happen because of lack of proper communication and understanding. So I will try my best to communicate and actively listen other person to avoid the conflict. And regarding this scenario, I will first approach my colleague and see which patients he wants to cover, and because patient safety would be my first priority. So whatever patients he wants to handle, I will go with him, and I will, like, if I'm doing easy patients, if he wants to do easy patients, I will go with him, and will let my attending and mentor know that he's dealing with these patients and I'm dealing with these patients, and will make the list easy for both of us.
Okay, great. Excellent answer. Anybody else wants to give it a jab, take a stab at it? Anyone? If not, we can definitely move on. All right, so let me bring back the speaker view. Okay, all right, so the next question, which one do you want to do? Okay. All right, so I think we will cover the question that Noor asked. The resident is not showing up. Okay. Noor mentioned that she got this question. Noor, can you please say your question again? Maybe we can look to address it.
Sure, Dr. Khan. So I was asked this question that you are an intern and your co-resident who is also an intern, they have been turning up really late for the past 1 week. They haven't been seeing their patients for the morning rounds. They haven't been presenting their patients, and you have had to maybe see some of their patients. So what are you going to do about it, and how are you going to approach it? What are you going to do about the resident as well as his or her patients?
Okay, great. And do you mind giving a quick answer how you approach this?
Yes, sure. So I told them that first of all, I would talk to the resident and make sure that they're all right, because sometimes you're facing some problems in life, and maybe that resident they are not sharing their problem with you or with anyone else. So first of all, I would make sure that the resident is not facing some kind of problem. And as far as the patients are concerned, I told them that I would try to see as many of their patients as possible before the morning rounds without compromising on patient care, because there is a limit up to which I can limit to the number of patients that I can see in a day. So if I feel that there are a lot of patients and I can't see all of them before the morning round, I would inform my attending and I would ask for help. um, and then I would talk to the resident as well. And if I do not see a valid reason for them being late every single day and not seeing their patients, and if that it has been going on for a week, I would then talk to my chief resident about it, and also talk to my attending to maybe do something about it, because it's not fair for me to see all of these extra patients every single day for no reason. So that was the answer that I gave them.
Okay, great. Yeah, that's the right approach. Just to share with you, and I think I've shared this before, during my residency, when I was a PGY3, when I was a senior resident, and you have to be ready by 7, 8 in the morning for the morning rounds. You need to see all the patients. You have 2 interns, and we had 2 or 3 interns and 2 PGY2s, second year residents. And what ended up happening was that one resident, she would always come late, one PGY2 resident. She would always come late, and she would not help out with the interns, any issue they're having, or get all the charts ready, or get the computer ready, or things set up for the attending for the morning rounds. So because that was part of her job to be, be more of the coordinator as well. So she would come late, come quickly at the back and look at her patients, and that's it. Come out and not really help out with the team. So twice I mentioned to her, hey, I think you should be ready for the rounds, and we have these duties to do as well. She was still not able to comply. And then I definitely had to reach out to my chief resident, and they then had a discussion with her, and everything turned out okay. We had so yeah, so you have to sometimes, these things come up, these things happen, and that's why they're asking these questions, right? So these things come up, and that's why they're asking these questions. So definitely, let me give you another. So yeah, definitely, that's a good question, and I know things like things can happen where a resident is coming in late, and I've actually had this experience before when I was a medical student, where we noticed that one of the residents was coming in late, and that was not appropriate, and they were not ready for the morning rounds, perhaps. And what happened at that what happened then, and I would probably look to follow the same approach, would be that the senior resident actually talked to that individual, and they asked if there's any issues that they can help out with, or if this was a one-off thing, please be on time and please be punctual, and if there's anything we can help out with, please let us know. However, that resident continued to and maintained being late. Subsequently, we found out that the resident actually went and talked with the chief resident, and the matter was handled amicably. And yeah, that's how that was handled. And I do believe that if such a situation does arise, we will look to follow the same approach, just to make sure that patient care and patient care is satisfied, and that the team is working as a well-oiled machine, and our attending is always also happy with the performance of our team. Yes, so if anybody's late, we will follow a stepwise approach. Thanks for this question. Okay. All right, so let's do this. All right, so gallery view. All right, so let's jump on the question, what if the patient dismisses you, right? That this was another question that Noor, you had, correct?
I had this question. This is
Sorry, who had this question?
Denise.
Okay. All right, right. So, okay, so dealing with difficult patients, right? That is a very common thing. Dealing with difficult patients is very important, because that happens all the time. You have a difficult patient, you have a difficult patient, and that patient, messes up your whole day, right? Anybody who's actually worked in a clinical setting, they know that one patient can actually mess up your whole day, right? How did you handle that question? If you're okay in giving a answer.
Can you hear me?
Yes, Binesh.
Yeah, so I answered that in medical field, we often deal with patients who are feeling anxious, or they are feeling that they are not heard. So I always try to understand my patient's point of view. I start by giving them some space so that they have an opportunity to voice out their concerns. And when they are done, getting all that frustration out, I will then go on to address their concerns and tell them that what they are feeling is genuine. And I always try to stay calm in such situations. So I think just by listening to their concerns and telling them that what they're feeling is genuine and I'm able to understand it, most of the times I'm able to deal with those patients.
Okay, great. Yeah. So absolutely. Yeah, definitely. It does happen that there are patients who may be a bit more difficult than others. And I've learned to realize that this is largely because they are under so much stress and anxiety, and they're in a different environment, and things are happening to them on a daily basis that they might even comprehend. And it may be a fault of the medical team or myself that I have not communicated properly. They may be getting different and diverging opinions from other people around them, and anything can happen in the hospital or in a clinical setting where things are delayed. They could get a little angry or be a little irate because of the multiple aspects that they're going through, and we have to look to put ourselves in their shoes and see from their standpoint. And when we are there talking to them, we will definitely look to hear them out. We will say that I understand what you're going through. I understand that you are under a lot of stress. We have to definitely empathize with them. And at the same time, we will give them the space and the room to breathe. And we will look to sit down and say that, hey, here I am, and I'm here to help you. And let me know what are your concerns, and we can look to address all of your concerns. And we will hear them out and look to provide them with the information that they need, and look to address their concerns. A lot of times I've seen that in my little experience, that if you just take a few minutes to listen to the patient, you may find the solutions that will make your job easier for yourself, and you will be able to address the patient's concern in a much more appropriate manner. So I think communication is the key to addressing any difficult or a patient that is difficult to deal with. Yeah, thanks for asking this question. All right. Anybody wants to take a jab at it? These are questions being asked, so I think it's better to prepare, right? So these are questions being asked. Anybody? Anyone? Going once, going twice.
Hi, Dr. Khan.
Yes, Mohammad Nasir. You want to give it a try?
I'd like to try.
Okay, great. So Dr. Nisar, so it happens that every week there's one patient that is difficult to deal with. It could be that their medications are messed up, or it's been taking too long for somebody to show up and answer the questions, or one of the family members are just very very nosy, and they're getting the patient upset as well as creating a scene in the room. So how would you handle a situation with a difficult patient, perhaps? Yeah, this happens a lot. Have you experienced a similar episode in the past, or how would you handle such a situation?
All right, thank you so much for asking this question. I do believe that situations like these can happen in a healthcare system because of the pressure and the workload. However, it is very important to be patient in these situations. The first thing that we should do as physicians is try to analyze when we enter the room of the patient, what's the like how the patient is, what the family is thinking about at that time. And if we do face difficulty in talking to a patient because of the presence of other people, and the patient actually wants the family not to be there, then it's really important to have a one-on-one interaction with the patient in a way. Not only that, but it's also important to ensure that your nonverbal clues as a are more friendly, and the patient feels that he's being like heard and understood. So the most important thing is to make the patient comfortable first, and then we can actually start conversation about the problem that the patient is facing.
Great, great, excellent, excellent, excellent. Anybody else wants to just open up, ease up, ease up on answering questions, just to feel light?
Dr. Khan,
Yes.
I wanted to ask you what they meant by the patient dismisses you. Like, does it mean that the patient does not agree with your treatment or management plan, or do they not want to be treated by you?
Okay, that's a good question. Yeah. Dismisses. So it could be taken both ways. If the patient dismisses, a lot of times the way it's taken is that the patient does not want to see you anymore. Yeah, that's one way to understand it. The patient does not want to see you anymore. Was the person who asked this question, was that person like a native English speaker, or is English with English as a second language?
Oh, she was a native English speaker, I guess.
Okay. Okay. All right. So I think I think probably this would be that if they dismiss you, they don't want to see you anymore. Okay. That happens a lot. I mean, doesn't happen a lot, but it could happen. So I think that's a good question to ask. So the way we will approach it is, again, same approach, empathy, communication. So you would approach it like this. Well, that's a good question, and I do believe that situations such as this can happen. And when such a situation happens, I think the first instinct for any human being would be to be taken aback and be upset. But I have realized, and I've seen some scenarios where, again, you have to be a professional individual and uphold the standards of the ethical standards of this profession to the highest degree. And in any situation such as this, I will look to sit down and approach the patient that I understand that there may be some concerns that you may have, and I fully would always agree with your decision in any matter. And but I would like to know a bit more detail if there was anything that I could improve upon, or is anything I can help with, that we can look to resolve any issue that you are having, and I could continue to serve you in any capacity that I can. But of course, there's no pressure at all, and but I just want to know if there's anything I did wrong, or anything I could improve upon or work with, and please share with me any issue that I've possibly let for you. So the patient will communicate if they agree, if they realize that I'm trying to analyze the situation, and if they are comfortable in sharing their issues, then I will listen to them, and I will look to address them, or any confusion that they have. I will look to remove that confusion, or readdress it in a manner that they're able to understand, because as we know, all of these issues happen due to communication usually. And I will look to try to break down any barriers, and I would at the end suggest that hopefully I was able to come, and hopefully I was able to hopefully I was able to address your concerns. Do you think this was reasonable? Is there anything else I can help with? If they don't have anything else, and you have developed a good relation, you can ask the patient, is it okay with you? And it's totally up to you if I continue to see you and take care of your needs. If they say yes, I would say, well, thank you for continuing to rely on my care. And if they say no, I will say that is perfectly fine. And if there's anything else I can help you with, please let me know. I will try to find a suitable replacement for myself, and I will give them I will give them a brief about your care so far, and they will look to take over from here. Okay. So I think maybe that's the way you can approach this. All right. Okay. All right. So anybody wants to give it a try? Anybody wants to give it a try?
I can give it a try, sir.
All right. Armit is the brave one here today. Okay. 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 So Dr. Khanal, so okay, ever had an experience where a patient is saying that they don't want you to be their physician anymore? Have you had that, or how would you deal with such a situation?
Thank you very much for the question. Yeah, I remember one moment when I was working as a medical officer in the emergency department. 26-year young male, he arrived to the ER with abdominal pain, and he was moaning in pain, and we were a bit in a rush, and nobody could attend the patient at the moment, and he was very angry and frustrated. And ultimately, when I approached the patient, then he was very angry, outbursting with anger, and he was saying that I don't want to see or taken care by you, but taking my being myself calm and composed and being more professional and taking care of patients is our topmost priority. Keeping that in mind, I approached the patient and I asked why he was being frustrated. Then he told me that it's already 15 minutes and no one is here to attend me. I am very frustrated with this pain. So uh, I I went there and then I said, I am here now, so I can do anything for you. What are your concerns? And I provided him a I provided comfort to him by saying that I will take care of the pain for you. So he was bit calm down at the moment, and he complied with the care that I was trying to give him. So that was the moment I de-escalated the anger of the patient, and we sometimes need to act quick because in the rush we may not attend all the patient at once because there are more severe patients than him at the moment. So yeah, that was the time when I addressed the patient issue and all keeping the patient care at the front. I became calm and composed myself. I did not let my anger take upon it, and that's how I dealt with the issue. Thank you.
Great. Yeah, you had an example, and the example was realistic enough, right? It was a fairly realistic example because this happens a lot, right? And and yeah, that's how you will deal with it. Okay. So all right, I just wanted some feedback from you guys. Okay. So what do you guys think are the positives of attending group sessions such as these? And you can just come up with the mic and just speak. That's fine.
I think
Well,
you
I will. Oh, sure. No, you go ahead. It's fine.
Thank you so much. I think the best thing about these sessions is that you get to hear different answers from a lot of different people, and then so you're getting a lot of input and you can come up with new answers. So I think the input is really great in these sessions.
Great. Anybody else?
Well, I like to add that it really helps you, boost your confidence because you feel that you have the answers, but you're not able to talk about them if you're in a group. So if you force yourself to actually answer over here, it really helps you actually.
Yeah, and we're just all, everybody's learning. I mean, everybody's learning. Even I learn something new whenever I talk to anybody. Ahmed, since you had so many answers.
Actually, this is my first time being here because I have observed your answers many times in the interview, and I was actually formulating my answers for my upcoming interviews. So I'm very grateful for the answers that you have been sharing with us, and I have been joining the WhatsApp group, and for I'm very thankful for today's session, and you are doing good, sir.
We
Actually.
We try. Okay. Manda, I forgot. I'm sorry. I covered your
Manda,
name.
you can call me Manda. Hi, everyone. Today is my first lesson with him in the group, but I'm enjoying it. I wish I would have found him earlier. I already surpassed 2 of my interviews without preparation.
No, it's all
So
good.
I'm so
Yeah.
thankful. I hope I'll do good. I mean, best.
Okay.
Yeah, because I have my upcoming interviews as well. So I'll work on whatever you have guided me. So I'll try to take more proactively in the group.
All right. Excellent. All right. So thank you so much for joining. I have to run today. That's why I have to move the time up for half an hour. Momna, just send me a message. Do you have my WhatsApp or? Okay, so that's the US number. Anyway, so thank you all for joining. Yeah, we have these sessions very regularly, and yeah, hopefully you can benefit, and let me know if any other question we can address. If you have already had some interviews, send me messages on what questions you are getting so we can look to address it in the future. All right. Thank you so much. Bye-bye.